Okay, so ladies and gentlemen, thank you for the opportunity to speak to you. My name is Pipin Kojodjojo. I'm a heart specialist, and specifically, I have an interest in heart rhythm problems. And so I'm talking to you today about some advances in the management of heart rhythm disorders. So I'm part of Asian Heart and Vascular Center. We are a group of 8 heart specialists, and we look after every aspect of any heart and lung condition. So more than 130 years ago, this English professor in London discovered that there's actually electricity within our heart. And so he was able to show using this experiment that we need electricity to make the heart beat. And as a result of the electricity, the heart functions. And so from his discovery, we then developed the ECG, which is something that I'm sure you will have had done if you've gone for medical checkups and things like that. And it's used millions of times around the world. And so this is an example of an ECG. And what it really does is that it records electrical activity in the heart. And it tells us that actually when the heart is normal and beating normally, our heartbeats are very regular. It is so regular that it's correct to 1,000th of a second. So, and you can see here that every beat is exactly the same. And so what our heart does is that it functions as a pump. So when the electricity is given to the heart muscle squeezes, and as a result, it pushes blood around our whole body and through the lungs and back. Okay? And so that's purely what the heart is supposed to do. It's the only function it has. And as I said to you, you need electricity for the heart to beat. And here I've shown you how this electricity is created and how it spreads through the heart. So you can see at the top of the heart here, you have a battery. Okay, we all have this battery. And the battery sends an electrical impulse across the top of the heart first, and then through a set of wires to the bottom of the heart. Now, as the electricity flows through the heart muscles start to squeeze, and then it forces the blood out of the heart. Now, most people don't know this, but our heart beats 100,000 times a day. And it starts from roughly 6 weeks in our mommy's tummy until the last day that we live. And over our lifetime, the heart will beat more than 3 billion times. And so any problem with the heart beating regularly is called an arrhythmia. And this is also a heart rhythm problem. And so generally, the heart rhythm, we can divide it into 2 kinds of problems. One is that your heartbeat is too slow. We call this in English bradycardia. Or your heartbeat is too fast, and we call this tachycardia. So we talk about bradycardia first, and bradycardia means that your heartbeat is too slow, and there's only one treatment for it. So if your heart is beating too slowly, we have to fit you with what we call a pacemaker. And a pacemaker is essentially a small little battery, and the battery is connected to 2 wires that goes through the veins into the heart. And so what it does is that the battery now replaces the natural battery of our heart, and it makes the heart beat by doing so. Okay? And so nowadays, these batteries are very, very sophisticated. This is a traditional battery. It's only 30 grams. This is a 50-cent coin in Singapore. So you can see the battery is actually very, very small. We put more than 1 million devices in worldwide a year. And around the world now, more than 9 million people carry a pacemaker. It can be done under general anesthetic, and it takes normally half an hour to 60 minutes. And the battery will last for more than 10 years, usually 12, 13, 14, not a problem. And for our patients with a pacemaker, they have no restrictions in terms of traveling, driving, or even work. And so this is a patient. You can see the pacemaker is just underneath the skin, and there's a very small 3-centimeter scar. Okay, but if you wear a shirt, you won't be able to see this. And on X-ray, you can see the battery here, right? So this is what the battery is here. And you can see it's connected to two wires, which is inside the heart. And the heart is this shadow that you see over here. Okay? And so pacemakers have been like this for maybe 20, 30 years, and this is fairly standard. What has changed more recently, perhaps, is that the pacemakers are getting smarter. So as you now know, we can use Bluetooth for many things. You can start your car with your phone and Bluetooth. You can, of course, pay in the shop. You can even turn your washing machine on. So now, not surprisingly, your pacemaker can also talk to your phone. And using your phone, it will send information to your doctor. And it allows us to monitor the patient's heart function and their heartbeat anywhere in the world. So I have patients in Vietnam, in Indonesia, in the US, in the UK, and they all send their information to me from their pacemaker through their phone and directly to us. Okay, and so this allows us to basically look after our patients all over the world, even when they are not in Singapore. The other advancement we have, which we have been doing for the past few years, is that there are also miniaturized pacemakers that doesn't have the wire that I showed you about. And these things are called leadless pacemakers. So unlike the one that we have to make a cut, basically for these ones, we insert the pacemaker from the leg. It is a very, very small capsule. So this is what it looks like. It looks like a little bullet. And what we do is that we poke the bullet into the heart, and then after that, we let go. And so there's no wires in this pacemaker. That's why it's called leadless. And all it is that this small little bullet is left inside the heart. And so instead of having something you can feel underneath your shoulder or having a 3 centimeter cut, this is entirely within the heart. So there are no wires, you don't see a scar, and it still functions like a pacemaker, right? So these are more expensive than the pacemaker with wires, but they work as well. And we implanted the first wireless dual chamber pacemaker in Singapore a few months ago. Of course, we can fit more complicated pacemakers. This is an example here. So just now I showed you a pacemaker with 2 wires. This is one that has 3 wires, and you can see the wire is much bigger. The wires are much bigger and the box is much bigger. Don't worry about the table here, but this is for a patient who has a very weak heart. And so this is a special pacemaker that by having all these extra wires and having a more complicated device, we are able to double the patient's heart function. So very low from 15 goes up to 30%. Still not normal, normal is 60, but this pacemaker has strengthened his heart. And on top of that, if this patient's heart was to stop at any point in time, something we call sudden death, that this pacemaker will give him an electric shock and it will restart his heart. So we can have very simple pacemakers, but we can have also more complicated pacemakers depending on what the patient. Okay, so we talked a bit about slow heartbeat. The next bit we're going to talk about fast heartbeat. And so this is what it will look like on the ECG. You can see that the spikes are very, very close to each other. And so this is a 7-year-old boy with a heart rate of 190 beats a minute. And he has a tachycardia, which means that the heart is beating too fast. Okay. Now, I'm going to show you a video in a sec, but before I show you the video, what does tachycardia mean? It means if your heartbeat is more than 100 beats a minute, sometimes patients don't feel anything. They come to a doctor and then they realize that when they do a checkup, there's something wrong with their heartbeat. But often patients will feel that their heart is running very fast. They feel tired. They feel breathless. So short of breath, they can get chest pain. They can black out. And unfortunately, some patients, they may die. Okay. And so I don't know how many of you were watching the football about a year ago. And this was an example of a very fit, healthy footballer who basically had a tachycardia and died on the football pitch. Fortunately, because he was in a stadium full of people and the doctors came to him quickly, he survived. But you may remember this. And this is how quickly these things can happen.
to make his way in for Finland. Play is going to be halted again, and this does look serious. Well, Christian Eriksen in some...
Well, players knew straight away that was a heavy fall.
To make his way in for Finland.
Okay, so that's quite dramatic, but essentially he basically was running around and then suddenly he died. And so this can happen very, very quickly when there are problems with the heart rhythm. Okay? And so here are some of the common questions I get from my patients. What causes it? Sometimes you're born with it, so we call this congenital. Sometimes we don't know why it happens, so it's called idiopathic. But often we can predict this because patients who will usually have other kinds of heart problems, they may have some hormone problems, like a thyroid problem. The other question I often get is that, is it dangerous? Sometimes it's not life-threatening, so you just don't feel well. But some heart rhythm problems can cause stroke. They can cause your heart to fail by more than 500%. And as I showed you earlier, you can be a few seconds away from dying for some kinds of fast heartbeat or bradycardia. And other questions I get is that, well, if I don't feel anything, am I safe? Unfortunately, no. The correlation between what the patient feels and how serious it is usually not very strong. Okay. And can it be picked up when I go for an ECG? Well, unfortunately, also not always, because some of these problems come and go. So like the footballer, if you did an ECG 10 minutes before he collapsed, he will have a normal ECG. But unfortunately, 10 minutes later, he died. So therefore, so just doing an ECG alone, unfortunately, doesn't rule out any problem. So often our patients will have an ECG, but also other tests to check for their heart problems. Okay, and so there are many types of heartbeat. I've just shown you the few common ones here. So there's something called SVT. This is usually for patients below 40 years old. So that 7-year-old boy, I showed you the ECG with a heart rate of 190. He has an SVT. The most common one, this is in older patients, is called atrial fibrillation. And the one that the footballer died from is called ventricular tachycardia. And this is the most dangerous kind of heart rhythm. Okay. And so how do we fix it? Well, most of the time we fix it using a technique called catheter ablation. It's actually quite simple. So it's minimally invasive. We just need to give you local anesthetic. But essentially what we do is that we put very, very fine wires. They look like spaghetti. Okay. And we insert it from the top of the leg and we put it into the heart here. And here we will then trying to start the fast heartbeat and identify the problem. Okay. And so usually once we find the problem, we can deliver laser or radio frequency energy to burn the problem away. And the whole process takes about 1.5 hours. And usually patients are in hospital for only 1 day. And the success rate is very high, more than 99%. And we have come a very, very long way in the last 30 years. If you had this problem before 1992, there was only one way to fix it. And this is a photo from a very, very long time ago when we were doing this. And the only way to fix it is to cut open your chest, for us to do the testing, and for the surgeon to use a knife to cut away the problem. Okay? But ever since 1992, when we had all the ways to put all these wires in, patients no longer needed open heart surgery anymore. Okay? And so even for a 9-year-old boy, we can do this very simple procedure and he will never have an attack again. Okay, so I'm going to spend the next few slides talking about atrial fibrillation because this is really the most common problem that we have. And essentially what happens is that we have disorganized electrical activity or short circuits in the top 2 rooms of the heart. Okay, and so the top 2 rooms is called the atrium. There's one on the right and one on the left. And because the heart is going crazy at the top, the bottom of the heart beats irregularly and very fast. Now, there are 4 reasons why AF is important. One is very, very common. and it's more common as we get older. So in fact, by the time we get to 80 years old, and most of us will get to 80 years old, 1 in 10 patients will have atrial fibrillation. Secondly, the local and global population is getting older. It is the most common heart rhythm problem we have in humans. Now, we know that just getting AF, it increases the risk of you dying by 200% and stroke by 500%. So we know that 1 in 6 strokes in the world is caused by atrial fibrillation. I think it's probably even more than that. And the strokes that are caused by atrial fibrillation are more disabling, so they are much more serious strokes. And not only that, if you have AF causing a stroke, you're very likely to get a second stroke. Now, AF can also be very hard to detect. Many patients have no symptoms, and they may not know that there's something wrong, right? If symptoms are present, the most common symptom is palpitation. And as I shared with you earlier, the ECG is only abnormal when the AF is actually happening. So it can come and go. So if you have a normal ECG today, it doesn't mean the patient does not have AF. And so because of all these problems, AF is actually very expensive. AF costs more than $10 billion per year in the US alone, and it causes strokes. And strokes are the leading form of adult disability. And usually once patients have a stroke, there's a significant impact on family life and on their ability to work. So when you add all these things together, it's common, it's dangerous, it's hard to find, it's expensive to treat. This all results in a major healthcare issue, and almost every country in the world is going to have to deal with AF in the years to come. So sometimes patients will ask, well, how is it that a heart problem can cause a stroke, which is a brain problem? And the reason is this. So when you have atrial fibrillation or AF, the circulation of blood through the top of the heart is not very good. So you tend to form blood clots. And you can see here on black, and on the ultrasound, you can see this lump here. And sometimes the clot is very big. So here's another ultrasound clot of as 8 centimeters. So if you have clots in your heart and the clots unfortunately fly off and they enter your brain, then it stops the blood supply to one part of the brain. It causes this part of the brain to be damaged forever. Okay, so if this part of the brain controls your left hand and your left arm, then you will not be able to use your left hand and left arm. And so in order to prevent stroke, most patients with AF will take blood thinners for life. And they cannot stop the blood thinner because once they stop, the risk of a stroke becomes very high. But we know that some patients cannot take medicine, or they are taking medicines, but they develop side effects, or they get bleeding from the side effects. Then what do we do to prevent their stroke? One way we can do this as an alternative to taking blood thinners is to put basically a device that will block off this blind end to the heart. Now, there's a blind end in the heart or a dead end, and it is called the left atrial appendage. And most of the clots that cause strokes come from this appendage. So what we can do is that we can insert, this is like a cap to the appendage, so that this appendage will become blocked off over time, and therefore no clots can form in the heart. So this is a patient of mine. We've left the cap inside, and you can see 6 weeks after that, the appendage, which is usually here, is gone. So there's nowhere to form a clot anymore within the heart. And the effect of it is as good as patients taking blood thinners for life. Now, apart from preventing the stroke, in many of our patients, when they have AF, they don't feel well. They feel palpitations, they feel breathless, they feel chest pain. So if we give them medication, how good is the medicine? Right? And unfortunately, the medicine doesn't work very well. So even if you give our best medicine, it works in less than 30% of cases. So most patients, in fact, the medicine does not work. So the alternative is for us to do something called ablation. I showed you earlier where we put spaghetti into the heart and we are able to use laser to treat the patient. And when we do ablation for these patients, the success rate is more than 90%. So much, much better than taking medication. Okay, now AF ablation is a little bit more complicated than doing some of the SVT ablation. It's a more complex type of ablation. So in order to do that, we will use very sophisticated mapping systems. And what it does is to help us recreate the anatomy of the heart. So everybody's heart looks a little bit different, right? And so we will create the anatomy for you. I will show you, this is a CT scan of my patient. And when we recreate the anatomy using this system, you can see this 1, 2, 3, 4 veins, which is what we've colored in color here. They look exactly the same on the CT scan as what the system has reconstructed. Okay? And now these 3D mapping systems allow us to see electricity flowing within the heart, and it allows us to find out what the problem is, and therefore from that, we can give you treatment. We will plan treatment, how to laser which part of the heart in order to fix the atrial fibrillation. Now, in most of the cases of AF, the abnormal problems comes from these structures called pulmonary veins. And so what we will do is that we will draw a circular line around the pulmonary veins, and that will stop the atrial fibrillation. So the lines look a little bit like this. And you can see the patient here who is having AF for 2 years. When we do the treatment, the heart rhythm goes from irregular to fast to normal. Okay? And we can do this 2 ways. We can either use laser or what we call radio frequency. This is to burn the heart. Or we can use cryoablation, which is to freeze the heart. So we freeze the heart to minus 50 degrees. And that is to allow us to achieve the same effect of blocking off the abnormal signals coming from the vein. We can also do this in the bottom of the heart called the ventricle. And remember that footballer I showed you who died, he had ventricular tachycardia. And so if he was to have more and more of these episodes, again, we can put the wire inside the lower chamber of the heart. And just like AF here, we have a patient whose heart is beating very fast. We turn the laser on, and immediately the heart goes back to normal. So we can also use the same tools to treat dangerous heart rhythm conditions. And I want to show you a lucky footballer, because this footballer came to see a doctor, and we knew that he had heart problems. So we were prepared. And you see, unlike the first footballer who died, this footballer was fitted with a special pacemaker. So even though the special pacemaker called an ICD will save him automatically. Doesn't require any doctors or anyone's help. You can see the pacemaker kicks in here, so his leg jumps. And after that, his heart goes back to normal. And so without a doctor coming, he will wake up and he can continue playing football. Okay, so here's some general advice for everyone. Be vigilant. If you don't feel well, please go and look for a doctor and have the appropriate test. I would suggest that one way to prevent heart disease is to have a healthy living and lifestyle. For those who are at risk, older patients, those with diabetes, high blood pressure, or do a lot of sports, you should have regular checkup. You should learn to feel your pulse. You can either feel it, or you can use a blood pressure machine to do it. Or nowadays, all the watches, whether it's a Samsung watch, an Apple watch, is able to monitor your heartbeat and even do an ECG. And that's a very good way to monitor for the health of your heart. If you have an unexpected diagnosis, or someone in the family suddenly died, this may be a sign that there is a genetic disease or a disease that's passed within the family, and that should prompt you to talk to a doctor about this. And finally, in Singapore, we have a practice of training non-doctors, so normal people, do CPR. This is cardiopulmonary resusc, and that is to help if you have family members, colleagues, or friends who run into trouble. You can be their first line responder and potentially save their life by starting resuscitation before you getting them to the hospital. Okay, so in summary, our heart beats according to electrical impulses traveling through an electrical system in our heart. The diseases that affect the electrical system are called arrhythmias. Common symptoms include nothing, giddiness, palpitations, or blackouts. Any type of arrhythmia can now be treated, and we usually use technology-driven treatments. These are pacemakers, ICDs, or ablation. We can prevent life-threatening complications such as stroke or even sudden death. Okay? And the important thing for everyone is to recognize symptoms and to seek early medical advice. So with that, I thank you for your attention. Sometimes people call me the electrician of the heart, and that's because we deal with heart rhythm problems. Just a reminder that we are a group of 8 heart specialists. We work in Parkway hospitals in Singapore. I thank you for your attention again.